My name is Laura Andrews, and this is my Axial Skeleton lab. I will first focus on the bones of the cranium, then the face, and then I will move on to the ribs and the vertebral column. So first, the cranium. First, we have the frontal bone, which is right here. It makes up our forehead. Then on the left and right side, we have the parietal bones here and here. On the posterior side of the skull, flip them around, we have the occipital bone. And we have a bony notch right here called the external occipital protuberance. And here, this serves as the link for the neutral ligament as well as the trapezius muscle, and also serves as a landmark for the 10-20 system in EEG recording. Now on the left and right sides of the skull, we have the temporal bone here, right there. Sticking with the external part of the skull, we have the temporal mandibular joint, which allows the jaw to move up and down. This notch right here is called the mastoid process, and deep to that, right back here, we have the styloid process. This colored part right here is the external acoustic meatus, and there's also an internal acoustic meatus, which I'll show you in just a sec. Now internally, we have the petrous portion of the temporal bone, which is where the middle and inner ear cavities sit. I have the internal acoustic meatus, which transmits cranial nerves 6 and 8. Now going back externally, I have the sphenoid bone, which sits in the eye socket deep to the lacrimal bone. So first I have the lacrimal bone here, and deep to that is the sphenoid bone. And the sphenoid bone internally has two different parts. It has a lesser and a greater wing. So here we have the lesser wing, and then back here we have the greater wing. Whoops, oh no. Let's see, and now, sorry, the knee just fell off. Now we also have, in that same area, the superior orbital fissure, which allows cranial nerves 2, 4, and 6 to enter the orbit. We'll use that later. Within the internal part of the skull, I also have the optic canal, which allows the optic nerves to pass through. And I also have this notch right here called the stella turcica, which is where the pituitary gland or the hypophysis sits. Still remaining internally, now toward the front of the skull, I have the crystal galli, which is where the dura mater of the brain adheres and to help secure the brain to the cranial cavity. And then I also have the cribriform plate, which allows the filaments of the olfactory nerves to pass from the smell receptors in the nose to the cavities in the brain. Now going back externally, talk about the sutures. First, I have the coronal suture, which runs and splits the brain across into a frontal and a dorsal section. This is the coronal suture, which is where the frontal and parietal lobes meet. I have the sagittal suture running along the mid-sagittal plane of the skull, which connects the left and right parietal bones. On the posterior side of the skull, I have the lambdoid suture, which connects the parietal and occipital bones. And then on the sides of the skull, I have the squamous suture, which connects the parietal and the temporal lobes. Not lobes, I'm sorry, parietal and temporal bones. Focusing on the facial bones, first we have the maxilla, or the upper jaw, and the alveolar processes, where the teeth connect into the jaw. I have the nasal bone, the zygomatic bone, which is a combination of the squamous part and the zygomatic process, the ethmoid bone, which is here, and the vomer, which is a combination of the vomer bone and the perpendicular plate of the ethmoid bone. So the ethmoid bone runs kind of like an upside-down T shape. I also have the inferior nasal concha, which forms the two lateral sides here and here of the nasal cavity. Now, speaking specifically about the mandible, I have the body of the mandible, which runs the length here. I have the mandibular angle here. I have the ramus of the mandible, which runs up and down. The mandibular condyle here, which is where the coronoid process meets. And then I also have the mandible notch, which is this guy right here. Now moving on to the vertebral column. So this isn't exactly the best example because the curvature of the spine is pretty rigid, but there are four main curves when it comes to the spine. You have the cervical, thoracic, lumbar, and sacral. The two primary curves are the thoracic and the sacral, which are convex in their curvature, convex, and then we have the cervical and the lumbar, which are concave in their curvature. Just pretend like this guy has more curve than he really does. So in regards to the cervical vertebra, there are 7 vertebrae, and there are 2 that are very unique to the situation here. There's the axis and the atlas. And the atlas is C1, and it articulates with the occipital condyles of the skull and allows for the nodding of the head. The processes of the cervical spine are unique because their transverse processes contain foramen, which allow vertebral arteries to pass into the brain. The rest of the transverse processes of the rest of the vertebrae do not have these foramen. Sorry about that. I'm back. I had to go grab my laptop charger. So picking up where I left off with the thoracic vertebra, there are 12 thoracic vertebrae. And they have the spinous processes, which is the part that sticks out that you can feel in your back when you run your hand up and down your spine. You have the transverse process, which runs out laterally on each side of the spine. You can't see it in this particular diagram, but the intervertebral foramen is the hole that is just posterior to the body of the vertebra, and that is where the spinal cord runs through. Here you can kind of see in this particular model, but there are small lines here in between each of the vertebrae. And these are the imaginary intervertebral discs that sit in between each vertebra and support the spine and also cushion it against harsh impact. Now there are 5 lumbar vertebrae, and then these 5 lumbar vertebrae then connect to the sacrum, which is 5 fused vertebrae, as well as the coccyx, which is 4 fused vertebrae. Now, moving on to the sternum. The sternum is a unique bone. It has 2 parts to it. It has the membrium, the upper part of the sternum, and the body, the lower part of your sternum. At the top of the sternum, we have the jugular notch, which is when you feel in between your clavicle here. That notch right there, right underneath where your Adam's apple would be if you had one. And then at the bottom, you have the xiphoid process, which is the bony protrusion. You can feel it here if you push hard enough. Now focusing onto the ribs. We have 12 ribs in the human body. The first of them is very flat in terms of its shape, but the following 6, so ribs 1, 2, 3, 4, 5, 6, and 7 are considered true ribs because they actually articulate with the sternum. Ribs 8, 9, and 10 are considered false ribs because they do not directly articulate with the sternum. Instead, they articulate with rib 7 via costal cartilage and then articulate with the sternum. Down here, ribs 11 and 12 don't articulate with the sternum at all. These are called floating ribs, and what they do is they actually articulate with the muscles of your abdomen through their ligaments instead of going all the way around to the sternum or attaching to rib 7. Ribs are considered flat long bones, and at their articulation here with the transverse notch of the spine is the head, and there's a narrowed notch, and there's also, now the wedge-shaped head on the posterior end articulates with the vertebral body in 2 facets. One joins with the same number of thoracic vertebrae, so for example, rib 7 would articulate with T7, and the other articulates with the body of the vertebra immediately superior, or right above.